Good morning, everyone. You're welcome to the BFEG Voice. My name is Lucy Isaiah, and I'm here with Dr. Carol. And today, as you're all aware, we'll be talking about cancer awareness. Dr. Carol is one of our local GP, and she specializes on cancer, and she's been working alongside with us for the past couple of months. We've been to a lot of women group women group in Woolwich, Kibrook, and also Faith Group, which is the St. Peter's Catholic women. It has been amazing being part of this great project. This project is supported by Southeast London Cancer Alliance, and we've been working closely to bring more awareness, especially to our Black and ethnic minority community, making sure they are aware of what is available on NHS, how can they access their GP, get themselves early diagnosis, because statistics have shown that most of the time, before our people from our ethnic minority get diagnosis, it's always at the late stage, stage 4, and then it is very challenging to treat. Also challenging for the family, challenging for those that is affected. So guys, me from you, as I'm very passionate about this because my late dad died of cancer. My late sister also died of cancer. So this is very close to my heart, and I know how challenging it has been for my sister when she was also diagnosed very late, and even though she was a nurse, so that affected us a lot, and I was part throughout the process when she was receiving treatment, and I know how challenging it can be for even the person that is being affected and also for the family. So this is very close to my heart, and that's why I put my heart and soul and making sure everyone gets this information. And I know more people are wanting to partner with us since they heard about this, and just want to say big shout out to the team who has made it possible for us to be part of this. Chris and the other team, the chairman that has been working closely with us, and also the EVA. Is it the EVA project that has been working closely with us? We want to say big thank you to you guys. It has been amazing working with the team. So I'm going to hand over to Doctor to introduce herself, and then we'll go straight to why we are here today. Thank you.
Thank you so much, Lucy. Hello, everybody. My name's Dr. Caroline Hollington. I'm a GP in Charlton, which is within the borough of Greenwich in southeast London. And I work there in my GP practice 3 days a week. I've been a GP for over 25 years now. But I do another role within Greenwich, and that's I'm the lead GP for cancer in Greenwich. And that role means that I get out and try to educate both GPs about cancer, but also do this amazing, interesting work getting out to meet people in our community. And it's been really fantastic to work with Lucy and the team. And I've learned a lot through the sessions that I've attended. And there's a lot of learning for me to take back to my GP colleagues and back to the system about how certain communities find accessing healthcare and the challenges that we have. But I'm really passionate about raising awareness, particularly in communities where we know that awareness might not be at the level it needs to be, and where we know that inequalities are happening. So thank you very much, Lucy, for inviting me along today. This is my first ever interview on a radio station. I am a little bit nervous, so bear with me. But
You're doing so well. You're doing so well. It's going to be an interactive session. You're doing so well, and no, it's not like the politician interview. It's not a. This is a good campaign. It's not a political campaign. So, Dr. Caroline, I just want to say thank you again for joining us, taking out of your busy time, because I know as a GP, your hands are full. There's a lot of things you need, but taking this time to always be with us, even in the odd hour, odd day, out of office hour, that shows how passionate you are, and also shows how willingly the Southeast NHS are working closely to see that this message get out there. I'm going to start with my first question: that what is cancer?
So, Lucy, cancer is essentially where there's an abnormal growth of cells in your body, and those cells start to divide in an abnormal way and grow in an abnormal way, and the cells can then form something called a tumour. And that tumour is what most people will know about cancer. And then sometimes that tumour can spread to other parts of the body, and you might hear terms like metastatic cancer. That means when a cancer has spread from the initial place to another part of the body. There's over 200 types of cancer, so there's a lot of types of cancer. And then the other type of cancer that people may have heard about are cancers that affect the blood. So those would be cancers called things like leukemia, or you may have heard of myeloma as well. That's a much rarer cancer, but actually an interesting one, because it's much more common amongst the Black community, myeloma that is. And we know that in the UK now, 1 in 2 people are going to be diagnosed with cancer in their lifetime. So this is big, this is huge, and it's going to affect us all, either personally or someone in our family or a friend or someone we work with or someone in our church. So that's why it's really important that we start to increase knowledge, have these conversations, listen to each other as to what might be the barriers or issues around cancer.
Okay, sorry. Most time people normally ask that they don't really know what cancer look like and how it affects the body, and what are the signs that you need to watch out for you to know. Because as you know, NHS is under pressure, GP appointment is under pressure. What are those signs that people need to see and say, you know what, no matter how um, uh, busy I am, no matter how difficult it is for me right now, because from our community, most of the time, jobs, other family life, people are not able to reach out to their GP or taking that time. Now we're all going digital, which is a big challenge. What are those signs that you need to see, and that person needs to say, you know what, this is a red flag. I must do anything within my means to go and see my GP.
Thanks, Lucy. Well, those signs and symptoms are going to be different for different types of cancer. But I think my biggest message amongst all of this is the importance of getting to know what is normal for you, what's normal for your body, so that you become aware when something doesn't feel normal. And it's when that thing changes, and when that thing changes and might change for a couple of weeks and not go back to normal, that's the time that you really need to be taking action. And remember, many of the times there will be other much less frightening reasons for those symptoms, but those symptoms, certainly as your GP, we want to know about. So some very general symptoms that could be caused by a number of different cancers would be things like suddenly losing weight when you're not trying to lose weight. Now, you might be on a diet, you might be suddenly exercising, you might have had a very stressful time at work, so not eating. But if suddenly you're losing weight and you weren't expecting to, that would be something as your GP I would want to know about. If you were suddenly feeling exhausted and really, really tired, and again, there wasn't a very good explanation for that, it hadn't been that you hadn't been sleeping because, I don't know, you'd had exams or stress or whatever, again, we'd want to know about that. There's going to be lots of reasons why that might be other than cancer, but it could be an early sign of cancer. If you notice things like an abnormal lump or bump on your body, now that might be, in your breast, and we'd be thinking about breast cancer, but could be in another part of your body, particularly if that lump's come and not gone away within a couple of weeks, or that lump's getting bigger, or just looks strange, we'd want to know about that as your doctor. In terms of your bowels, so going to the toilet, if suddenly that changes, and again, it's what's normal for you. So if suddenly you're someone who normally goes to the toilet once a day and you're going 5 times a day to do a poo or open your bowels, and that lasts for more than a couple of weeks, we want to know about that. Equally, if you're somebody that normally goes every day and suddenly you're only going once a week, that's a change in your bowel habits, and we want to know about those. We want to know about bleeding. So bleeding coming from your bottom when you're pooing, or bleeding coming when you're passing urine, or bleeding coming if you're a woman and your periods have stopped for more than a year and suddenly you start to bleed again. So those are all things that your GP would definitely want to know about. We think about some of the other big cancers that affect us in this country. So lung cancer would be one of the other bigger ones. If you were feeling much more out of breath than normal, if you were having a cough that didn't go away for 3 weeks. Now, of course, the most common reason to get a cough is having a virus or having a chest infection. So the likelihood is you don't have lung cancer. But if you've got a cough and it's not gone away for 3 weeks, I want to know about that as your GP. Equally, pains that you can't explain in another way, pain that's come either in places like your tummy or having terrible headaches or pains in your back that you can't explain, that aren't going away, that are getting worse, that are waking you up at night. Those could all be symptoms or signs of cancer. Night sweats could be another symptom. So the sort of sweats that somebody might notice in bed at night drenched them. So they were waking up and they were having to go and change their clothing, having to change bedding. That could be a sign of cancer. Of course, for women of a certain age, sweating at night and feeling hot at night can also be a sign of the menopause. But we want to know, particularly if if it's so bad that you're having to change your clothes, and we want to know about that. Yes, so I'm thinking that's probably the biggest main ones off the top of my head. But again, going back to my message, it's getting to know what's normal for your body and what feels not normal for your body. And if you're not sure, please ask your GP. Please contact us. As Lucy said, times are changing and there's now this push for digital healthcare, and there's pros and cons to that. But it does mean that you can reach out to your GP online and contact them and saying, I'm having these symptoms, I'm not quite sure what I need to do. And if you came to me as your GP asking me, I'm really happy to give people advice. If you're not sure, there's lots of great information out there on websites like Cancer Research UK, like Macmillan Cancer. So you can always put in your symptoms, and if you're not quite sure if it's something you should be worried about, and get advice from those sources as well.
Very much. I think you've actually highlighted a lot of points during your explanation. And we know before the end of this session, we'll also ask you again to just brushing that through, because there's some people that are just coming into watch. Maybe they will also get that, because that's a very key information that you've given. The next question is, why is it important to get diagnosis of cancer as quick as possible?
Well, as you said, Lucy, when in your introduction, this is just so absolutely key for cancer. The evidence is clear. The scientific research that is out there is just quite astounding. The differences in the chances of your cancer being successfully treated if it's caught at an early stage. Lucy talked a bit about stage 4. So cancers are categorized into stages from 1, 2, 3, and 4. And 1 would be the very first start of cancer, and 4 would be where cancers had spread to other parts of the body. And generally, once that has happened, it's much more difficult to treat cancer. If we can catch cancers at stage 1, the treatments are much more likely to be successful. You may well be cured of your cancer. Certainly your survival rate, so how long you would live after your diagnosis, is going to be much better. And we also know that the treatments you might need to have if your cancer is diagnosed at an early stage may well be much less invasive and difficult. So for instance, for some cancers, if you diagnose them at stage 1, at a really early stage, you may only need to have the cancer removed by a surgery. Whereas at a later stage, stage 2 or 3, you may need the surgery plus chemotherapy, plus radiotherapy. You're going to be off of work for much longer. You're going to have the side effects of those more difficult treatments. So that's why getting early stage diagnosis is so key. And that's why we're trying to get these messages out about people getting checked early, people going for their screening tests and the cancer screening programs. That's what they're trying to do, is to pick up cancers at that early stage 1.
Thank you very much. There's some. This is for those that have already got diagnosis. We've seen over the years, some people when they get diagnosis, they say that they believe it or they don't believe it. I have somebody in my family that they were diagnosed and they were saying, no, that's not true. That's not true. When it comes to lung cancer, is it only those that are smoking that get lung cancer?
No, and that's a really important message to get out there, actually. And it's been a change. So in the time from when I've been a GP, so 25 years, we are seeing changes in some of the patterns of cancer. So in the past, lung cancer was primarily seen in people who were smokers or who had smoked in the past. What we're seeing now, actually, is a shift, because thankfully in this country, it's great. We're seeing less people smoke. That's wonderful. But we're seeing more and more lung cancers now in people who have never smoked. And we're seeing lung cancers now as well in younger age groups, and actually particularly in younger women who have never smoked. We're not quite sure of the reasons for that. But again, it's just important those messages are out there. So essentially anyone who has a set of lungs can get lung cancer. And that's a message that needs to be spread both amongst patients and doctors, getting that message out there. So yes, although smoking is a massive risk factor for lung cancer and many other cancers, actually you can develop lung cancer if you have never been a smoker.
Thank you, because I think that message needs to be out there because most people would think, I'm not smoking. Why should I get a lung cancer? And this again, the fear monger among, like for instance, now when you've been diagnosed with stage 1 or stage 2, stage 3, um, f- a lot of people get scared and get worried and started they would like to or not, they don't believe that they will have cancer because they believe they've been well, they don't do what actually leads to cancer. So what would be your message to those that have been diagnosed, so that, because sometimes it's the fear that kills people, what would be your message for those that have been diagnosed and those family around them, friends and family that try to be doctors around them?
Yeah. It's really difficult, Lucy, and I think people's responses to a diagnosis of cancer can be really variable. And I've seen it both, personally in my own family life, but also with my patients. How people respond can be really, really different. And until you're in that situation yourself, it's really difficult to know how you would respond. I guess my main message would be about allowing people to feel heard, allowing them to express their emotions and trying to be a support for them, and letting people lead in their own way. One of the most common things we hear from people who've been diagnosed with cancer is that actually, sadly, they find that often many people in their life disappear around the time of a diagnosis. And that may be because the friends or family themselves feel frightened or scared, or they're not actually sure what to say. They think, I'm going to say the wrong thing. So instead of saying anything, they back away completely. So people can feel very lost around that time of diagnosis. So I think if you're not sure what to say to somebody, you can say that. You can say in a message, I'm really not sure what to say, but I just want you to know I'm thinking of you. And if you need me, I'm here. So messaging like that can be really, really helpful. There are some wonderful organizations out there that either you as the person supporting can get information from, but you can also encourage your friend or family member to look at. So Cancer Research UK, Macmillan Cancer Care, these are big charities who have lots of information on their websites. They have telephone helplines that can give you lots of information both about the cancer, the treatment, how to support somebody with cancer. We've heard from people with cancer that actually what is often most helpful, rather than saying messages like, I'm here, tell me if you need anything, is actually offering particular bits of help. So I would like to drop off a meal to you this week. I would like to offer to pick your children up on a Tuesday afternoon from school. So sort of offering those particularly, so the person with cancer, in amongst everything else that's going on, is not having to think about what can I ask people to do. People are offering actual practical. I'm happy to come to some of your appointments with you. Would you like me to come to your next radiotherapy appointment? I can drive you there. So offering those sort of concrete, specific offers of help can be very helpful. But equally understanding that there'll be times when that person will want their own privacy. There'll be times when their treatment might make them, if they've had chemotherapy, they might be particularly tired and not respond to messages. So just checking in on a regular basis, thinking about you, you're in my thoughts. That then allows the person on the other end to reach out as and when they feel they would like to. But the issue that you talked about, Lucy, is one that's particularly worrying to me, and that's when patients or families may not, as you say, believe that diagnosis, or maybe not want to seek treatment because they have, I don't know, particular health beliefs. And that's when I think we really need to think about how we work together to get those messages out there, that because I know there's a lot of distrust about the medical community, and that's been a big issue, particularly since COVID, that people are perhaps being fed misinformation about things, reading on social media about cancer or various other things. So we really want to encourage people to get out there and perhaps talk to a more trusted, if it's your GP you trust, talk to your GP. But if it's someone else in your community that you can reach out to and trust, talk to them about things. We know that some communities think that cancer is contagious, so you could catch cancer. That's not true. That's absolutely categorically not true. We hear about people here talking about things that cancer might be a curse sent down. And, I would like to think that a kind God or whoever you might believe in wouldn't do such things. So I certainly don't see that as a thing. But we know that those beliefs are out there. So we really want to work together to try and understand those and squash those.
Thank you. That brings me straight to another question, which said, a lot of people that has been diagnosed with cancer, is there? I know they talk about family history. Can that actually give a warning sign to a lot of people to prompt them? If somebody in your family has had cancer in the past, there's a high tendency that you might have it.
Yeah. So that certainly for a number of cancers, having somebody in your family who's had that cancer will certainly increase your risk of cancer. So that doesn't mean you're definitely going to get it, but certainly it can increase your risk. So being aware of the history within your family is really important. Um, and thinking about the Black community in particular, for instance, prostate cancer. So prostate cancer, we know it's a common cancer across the whole of the UK, but we know for Black men, it's twice as common as white men. And that probably there is a genetic underlying that. But we know also if you've got a family history of prostate cancer, that really increases your risk. And interestingly, for men as well, which they might not be aware of, if you're a man who has a mother or a sister who's had breast cancer, you have an increased risk of prostate cancer. So yes, you're absolutely right. There is a number of cancers that your risk is increased if you have a family history. It doesn't mean an automatic cancer diagnosis, but certainly, and that's important things to be aware of. So when you go to your GP and you can say, I'm worried particularly because I have a family history of this type of cancer. And we would definitely want to know that information, because it would be part of our decision-making process about what we're going to do next, what investigations we might be arranging for you.
Thank you very much. My next question is, I want you to put highlights on the importance of ED screening, awareness of change in the body.
Yes. So I think we've touched on those
A
before.
little bit about, yeah.
I guess screening is the one that I just want to really highlight.
Mm.
So cancer screening means looking for signs of either very early changes or very early cancers before you would even have a symptom of it. So at the moment in this country, there are 3 cancer screening programs that people might have heard of. So there's the breast screening program, and that's for women between the age of 50 and 70. And women are invited every 3 years to go and have a test called a mammogram, an X-ray test on the breast. And that's trying to pick up cancers that might be so small that you wouldn't, if you're examining your breast, you might not even feel that lump. So that's the breast screening program. Then there's cervical screening, and that's looking for, now in the country, what it looks for actually is the HPV virus. So women are invited between the ages of 25 and 64 to go and have a cervical screening test. We used to call it a smear test, and many people still do call it a smear test, but that's a test done at your GP practice, normally by your nurse. And what the test is doing is looking to see if you have the HPV virus. If you do have that HPV virus, they then in the laboratory have a closer look at your cells. And again, this is looking for really early changes that can be treated before they might not even turn into cervical cancer. And then the other screening program at the moment is bowel screening. So that's looking for hidden blood in your poo. And that's something that comes through the post every 2 years from the age of 50 up to 72. And you get a little kit in the post. You take a tiny sample of your poo or your stool and you send that back in the post. And that's looking again for blood that you wouldn't even notice if you were looking at your poos, and because those can be a sign of a bowel cancer. That's the 3 main screening programs in this country. The other one that's currently being rolled out is the lung cancer screening program. It's currently a pilot, but within the next few years, we think that's going to become a national program, and it has been in Greenwich. And that is for smokers and ex-smokers between the age of 55 and 70, and those people will be invited to have a consultation with a nurse, a discussion, and then if they're deemed to be at high risk of lung cancer, invited for a CT scan of their lungs. So that's the screening programs. And sadly, at the moment, we're seeing, the rates of people attending or going to these programs are really so far below what we would like them to be. And we know if we got people to have these tests done, we would save thousands of lives every year. So we really want to get the word out there about those. When you get invited, go. And if you've been invited and you thought, oh, I'm too busy, or oh, I'll do that later, you can still go. Yeah. So we want to see you. We want you to have those tests done.
Thank you, Dr. Carol. That brings me to another question regarding to the young people. Recently, parents are receiving text message saying to them there will be an immunization for HPV. I know a lot of parents might just not even take note of it or not bother to go online sign, because you need to sign to get consent before they administer this to your child. If you what age and what is your advice to parents once they receive this message, and what should they do to make sure that their children are
Yeah.
vaccinated?
So the HPV vaccination that's offered to children in schools is one of the biggest, most exciting things to happen in the cancer world in the past few years. So we talked about HPV and that virus, human papillomavirus, and how there is a link to cervical cancer. The human papillomavirus also is linked to some bowel cancers, rectal cancers, and also to some head and neck cancers. So cancers affecting the throat, the tonsils, the tongue, and the mouth. And where we're seeing where there's been high uptake of the HPV vaccine, so in countries like Scotland, where I come from, and some other countries across the world, we are seeing cervical cancer rates massively plummeting. And actually, we think in some of those countries, there soon will be no cervical cancer, which is just astounding. So to be given the chance to have your child vaccinated against something that may mean that they wouldn't develop cancer at a later age, I think as a parent, is just such an amazing opportunity and privilege that you could be part of this. We know, again, since COVID and vaccinations, there has been a lot of hesitancy, and particularly in some communities, and distrust and misinformation about vaccinations. But it's really, really important that you do this for your children, as I say, both because of cervical cancer, and actually I think that it's probably going to, as time goes on, we're going to discover more and more cancers potentially linked to that human papillomavirus. So please, if you're not sure, have a read up about it. Inform yourself, speak to your GP or your practice nurse if you feel you need more information. It's really a wonderful opportunity in the cancer world to see that a vaccination could actually prevent you developing a number of cancers in the future.
Thank you so much. This has been very interesting. I can see a lot of feedback, people coming to say, well done, thumb up, and your explanation is really great. My next question is, can you share more information about late stage of diagnosis of breast cancer in Black women and high risk for Black men in prostate cancer?
Yeah. So I think we mentioned prostate cancer before.
Yeah.
So yes, we know that prostate cancer is twice as common in Black men. We know that 1 in 4 Black men will develop prostate cancer in their lifetime. We know that again is increased further if you have a family history. We know that it also increased if you have a mother or a sister who has breast cancer. Now, why that is, we think again is probably linked to genetics, but there may be other factors, and there's obviously lots of research going on out there. What I would say is for Black men, we want them to have the knowledge and the information to then make a decision about whether they approach their GP and ask and discuss a PSA blood test. And that may be something people know about or don't know about. So that is a simple blood test that you can be sent for. And if your PSA level is raised, then you would be sent on for further tests. It's not a perfect test, and there are some caveats about the use of the test in that you can have a high PSA level and not have prostate cancer, or in rare cases, you could have a normal PSA and still have prostate cancer, but it's a pretty good, easy thing to have done. And, you know, it's easy to ask your GP, and most GPs now, for a Black man over the age of 45, if they were approaching me saying, can I have a PSA blood test? I would have no issues whatsoever with arranging that for them. You can have a look on the Prostate Cancer UK website. It has something called a risk checker, where you put in information about yourself, your age, whether you have a family history, your ethnicity, and then it will say, okay, this would suggest that you are at a normal risk, an increased risk, and then give you some advice. So that's prostate cancer. And the South East London Cancer Alliance has been doing a lot of work getting out to try and reach our Black communities across South East London with messages about prostate cancer, and also getting feedback from the Black community about some of the barriers there might be to men wanting to approach their GPs, or both shame, embarrassment, stigma about prostate cancer. So that's been a really big piece of work that's been going on and is going to be going on. So that's prostate cancer. And with breast cancer, there have been studies done that have shown that Black women are more likely to be diagnosed at a later stage than white women with breast cancer, and also more likely to be diagnosed with particularly aggressive types of breast cancer. And we think that's for multifactorial, many reasons why that might be. Studies have shown that amongst the Black community, Black women are less likely in some places to be aware of the symptoms of cancer. So if you're not aware of the symptoms of breast cancer, you're much less likely to go and see your GP at an early stage. We know that Black communities may find it harder to access their GP, and that could be for a number of reasons. Relatively simple things like language, it's a massive barrier for some people, but health literacy, digital exclusion. So as you say, there's a push for GPs to be all about online access, and some communities may find that more difficult. We know that some Black communities will be more deprived, so that may mean that they're working in jobs where actually they can't take time off of work to go to a GP appointment. Their employer may be less understanding, they may be on a 0 hours contract. So it's likely that there's a lot of factors playing into that, but that's why this sort of work that we're doing together, Lucy, and that the South East London Cancer Alliance are doing, is that we're so keen to get out and hear from the community. What are the barriers and issues you're having, and how can we work together to address them? In terms of the fact that Black women are diagnosed with the more aggressive types of cancer, it's likely that has a genetic factor. So yes, I think, have I answered that question?
Yeah,
Enough?
yeah, you
Yes.
have. Yeah, you have really answered the question. And one of the things I want to actually highlight in that area where they're talking about that we're more likely to have, and what can we also do as Black women? Because I know when we had the workshop last Sunday, where I think we splitted the group into two, going into breakout room, and we're asking what do we need to do, even though yes, the government, the NHS, yourself as a GP, um, Southeast London Cancer Alliance are doing their own job, but we as individual, as from a GP point of view, what do you think we should do more to get ourselves out there? They say you can drag the horse to the stream, but you can't force them to drink the water. So what do you think we can do more as a patient, as an
Yeah.
individual?
Um, so I guess, sorry to repeat myself, but these are
Yeah,
just such important messages. I think it's becoming aware of what's normal for you. I think it's being aware of our bodies and listening to our bodies. I think it's from a young age, having conversations with our children, with our elders, with our friends, with our communities, talking about breaking down stigmas, about talking about our body and body parts, whether that be breasts or pooing or bowels or all these things, so that these conversations just become part of our natural way of talking to each other. So for women, becoming aware or breast aware at an early age, starting to examine our breasts on a regular basis, so that we know what feels normal for us, because breasts feel different for everybody. And believe you me, I've examined lots of breasts in my time. They come in all sizes, all shapes, and so it's what's normal for you is not going to be normal for me. But if I get to know my normal, I pick up, oh, that doesn't feel quite right. I'm going to feel that again later this week. Still doesn't feel quite right. I'm going to feel it next week. If it's still not right next week, I'm going to try and speak to my GP about that. So yes, getting to know what feels normal, thinking about our general lifestyle and our health, getting the message out there. So as I said, thankfully we're seeing reducing risks of smoking, but there's still people smoking. Thinking about alcohol, trying to keep it a healthy body weight. We know that being overweight or obese increases the risk of a number of types of cancer. Thinking about our diets, and I think particularly as women, the role falls to us often of being the person who's controlling what the family eat, and also who's educating our family about what might be a healthy diet going forward. So we know for some types of cancers, so for particularly bowel cancer, the importance of having lots of fibre in your diet, not eating processed meats, so those sort of things. Exercise. Taking regular exercise will reduce your risk of a number of cancers, but also, really interestingly, if you've had cancer and you exercise after your diagnosis, that will reduce the risk of the cancer coming back. So there's a number of things in our lifestyle that we can try to take control of. But also, as you say, Lucy, and I think what's really key is just having these conversations and talking to each other and listening to each other and sharing and spreading, supporting each other if somebody is worried about their health or has been diagnosed with cancer.
Thank you very much, Dr. Carol. You have actually swing in into my next question, which is how can I reduce my chances of getting cancer, which you've talked about, and mitigating risks, which you've actually talked about. I think I'll just go straight to the other question, which is how can I help someone with cancer? I know you talk more about the support that are available there, but this I want you to look it into the area whereby most time when people tell us that they are diagnosed with cancer, um, we that are supposed to be the supporter are the one actually sharing all this um, what do they call it? How would I try to describe this doctor's message? You know, all this online message will start bombarding. We've seen over the years when our family or friends tell us that, oh, I'm being diagnosed with cancer. We start sending them all this diet, all this information we get from online. Take this 3 times a day, drink this, and it will clear your system. And also, trying to. It's good to pray. Faith is good, but um, also telling people that they should put more instead of them to encourage them about how their treatment is, but concentrating more on looking at the miracle side of healing. I did not say there's no miracle, but there are different roles that we play that can actually cause more harm to those in that. So from a GP point of view, what can we do medically and um, uh, in terms of both well-being to support somebody with cancer?
I mean, I think we touched on this before, and really it's emotional support, I think, is the absolute key. And then those offers of practical help. And I think if people are being bombarded with lots of information, I think it would be encouraging people to look to trusted sources for information. So again, looking to the big cancer charities like Cancer Research UK or Macmillan Cancer or their own medical team. Because you're right, there has been a massive increase in sources of medical misinformation out there, particularly on social media, about cures for cancer, treatments for cancer. And that makes me both sad, but actually angry as well, because often these things are coming with something that you have to pay for and promises that are just not in any way scientifically proven. And of course, when someone has been diagnosed with cancer, they are at their most vulnerable point in their life, and their family are at their most vulnerable point in their life. And people are often feeling absolutely desperate. Of course, you would do anything to be cured of your cancer, to save your loved one from cancer. But I would just perhaps encourage people to take a breath. And if somebody is sending them links or information about something they can buy that's promising to do something, say to them, okay, why don't we research that? Why don't we look on those trusted sites of information? Why don't we ask your nurse specialist, does this have any basis in it? before doing that. Because, there's been some very sad cases recently about, I think there was a young woman that was in the news recently who had refused all treatment for her cancer. And actually it was a cancer that was very treatable. But her mother had been a big part of this sort of movement around anti-COVID. COVID was all a conspiracy, and her mother had encouraged her to not have any of the treatment that was recommended for her cancer. And this young woman sadly died of cancer because of that. So yeah, I think encouraging people to look to trusted sources of information before being bombarded or seeking out other types of treatment for their cancers.
Thank you, Dr. Carol. I know last Sunday when we were at St. Peter's Parish talking about um, uh, um, Black community, migrant community, and one of the things that we raised, I think one lady raised the issue of immigration. Some people come in, they might not have no request to public form, or they're living in the country without their documents sorted out, and they have no register with the GP. That's one. And secondly, some of people from the Black community that have migrated from their country, cancer might not be something that their government is actually campaigning on, like the way we're doing it here. So some people might have already had early stage of cancer and not yet been not know, and maybe they are in stage, they don't even know when they were in stage one, stage two, not until they came into the UK and they start experiencing all this health issue. What would be your advice for those that, because a lot of people have come through the COS, or they come through work permit, or they come, what would be your advice for them as soon as they arrive in the UK? What should they do to make sure that they don't, because we've seen very high cases of our community being diagnosed with cancer. And some of them, they are just here in the country for 2 years or 3 years. Some of them, they've been here for a long time. What would be your advice to this, to the community?
So anybody who lives in the UK and is staying for longer than 3 months can register with a GP. So GPs are not allowed to, and we shouldn't be asking to know about your immigration status or asking to see your papers or anything like that. So anybody can register with a GP in this country, and you are then able to have all primary care, medical investigations, treatment, advice, etc. And it's really important that you register with the GP, because if you're not registered with the GP, you won't receive invitations to have your cervical screening, your breast screening, your bowel screening. That's the really key, to be registered with the GP to receive those invitations. So yes, it's really important. It was interesting to me actually to realize that message was perhaps out there, that you couldn't register with the GP, because you can. You most definitely can. And then I was just thinking about your other, yes. So if you perhaps have then come from another country and are now living in the UK, and you've got a diagnosis of a cancer, it's really important. Again, please register with your GP. Come and see us. If you've got information from another country, papers, etc., bring those with you, because those would be really helpful. If you don't, that's fine. Don't worry. We can work things through. But if you have got any information about tests you've had, or stages, or operations, or surgeries, then if you can bring that in to see us, that's great. But then what we would do would be to refer you on to the NHS for further treatment under the NHS. But yeah, my message is that please, we want people to not see those immigration issues as a barrier to coming to see it, registering with a GP and coming to see a GP.
Thank you very much. We're actually coming to the end of our session. It has been very informative, and I'm glad this is recorded on our YouTube page, which I'm going to share with you, Dr. Carol, so that I think this is something that everyone should take their time, listen to it, watch it, share it with their community because it's a packed full of knowledge, information that save lives. And before we wrap up for the day, like I said to you earlier on, some people might just be joining us. Which, if you can just go back and just recap and tell us what cancer is, and what are the symptoms of cancer, and how important um, it is for us to get diagnosis, because we have 5 minutes to wrap up. So
Okay.
over to you, Dr.
Thank
Karen.
you, Lucy. So cancer essentially is an abnormal growth of cells in the body. Cells start to divide in an abnormal way, and they then form tumours. 1 in 2 people in this country born after 1960 are going to get cancer. So it's huge. It's going to affect us all, either personally, our family members, our friends, our colleagues. And that's why it's so important that we spread awareness, we get out and we talk to each other about cancer. We know the real key to improving outcomes for cancer is diagnosing it early. Diagnosing it at an early stage means we're far more likely to survive your cancer. You're far less likely to need very invasive multiple treatments for cancer. And you might well be cured of your cancer if we pick it up at an early stage. The symptoms of cancer can be many. My main message, I sound like a parrot because I'm saying it again and again and again, is get to know your normal so you know what's not normal for you. And if something is not normal for you and it lasts for more than a few weeks, please go and see your GP. The sort of things particularly we want to see you about might be weight loss, that where you've not been trying to lose weight, but you're losing weight, feeling exhausted, and you don't have an easy explanation why you might feel particularly exhausted. A lump or a bump somewhere you're not expecting to find one. That could be in your breast, but it could be in different parts of your body, particularly if that lump's getting bigger, looks strange. Please come and let us have a look and a feel of that. Bleeding. So bleeding where you wouldn't expect to be finding bleeding. Now that could be bleeding from your bottom, bleeding when you pass urine, where you do a wee, or bleeding in women after the menopause, where you've not had a period for over a year and suddenly you start to bleed again, or indeed bleeding in between your periods for younger women who are still having periods. So bleeding in between your period, bleeding after having sex or during having sex. So strange bleeding, something we want to be seeing you about. Headaches, severe pain. So headaches that are terrible headaches getting worse. You're not someone that normally gets headaches and suddenly you're getting headaches week after week and they're really severe. Strange pains in your body that you can't explain. Back pain that's getting worse, that's waking you up at night time. Pain in other parts of your body. Feeling much more short of breath than normal. Having a cough that's gone on for more than 3 weeks. These are all symptoms that we want to be seeing you about. Swelling to your tummy, pain in your tummy, lumps in your tummy. And I think this all sounds quite frightening and scary, and I want to see you about these things, but I want to reassure you that 9 times out of 10, if I see you with these things, you won't have cancer. But let a doctor examine you and decide whether we need more tests before being able to reassure you that this could or couldn't be cancer.
Thank you very much, Dr. Kari. This has been an amazing session. I enjoyed every moment. I've learned a lot today, which message will be passed out. But for 2 minutes, I know you talk about young people, which we've not actually deliberate. I know there's because of the Gen Z we have now, that don't like to go to the doctors. A lot of our young people, GP, going to the doctor, going to the hospital is not their thing. They don't even leave their house, talk more of even going for a GP appointment. What would be your message for young people? And because we know cancer do affect young people. So what is your message for them?
Oh, that's a tricky one because I'm the mother of 2 young people, if you like, and sometimes it's difficult, isn't it, to give messages in ways that resonate with them, that they will take on board. But I think again it comes down to communication, doesn't it? In amongst families, having those communications, encouraging those conversations. Again, coming back to what's normal for your body, and getting to know what feels abnormal. And again, trying to direct them to trusted sources of information. So if they're going to read about health on social media, and social media can be a hugely powerful for good, but try to think about, is this actually somebody who can be fully trusted in the information they're giving me about my health? Hopefully we will see, amongst that generation, the move to digital will be a good thing for them, and that actually they may be able to seek healthcare more easily, because that's the world they inhabit and live in. And actually, cancers are becoming more common in young people. Thankfully, though, they're still really rare. They're still really rare, but they are becoming more common. So we do, again, want to get those messages out that your GP is somebody that can be trusted. When you come and see a GP as a young person, what you tell them is confidential, completely confidential in those walls within your GP practice. And I think that's important. Young people can worry about that sometimes. So yes, that would be my message, I think, to young people.
Thank you very much. We've come to the end of the session. It's an hour session, 12 on the dot. We started this session around 11, and it has been amazing. Dr. Caro, it's great actually speaking to you. And I just want to say big thank you for your time and your efforts and your knowledge, your vast knowledge. Very simple, thoughtful, and very easy to absorb, not overwhelming. Um, Everyone out there, my name is Lucy Isaiah. I'm the CEO of Black Female Entrepreneur Greenwich, and your host for this great event. For those of you that are trying to get on our radio station, I think Ogaga is here. This will be downloaded and pre-recorded so that you can actually watch it again over and over again. It is also live on our YouTube page. You can go to BFEG Greenwich on YouTube, and then you get to see some of this interesting information. I will be sharing it out on our website and all other our social media platforms. Thank you all for listening, and let's keep the message going. Let's continue to campaign. Let's continue to be our brother's keeper, our sister's keeper, and let us spread the word so that we can save lives. Once again, good afternoon, everyone, and you're welcome to the BFEG Cancer Project. Thank you, Dr. Carol. And I will say from me to you all, thanks for listening. I hope this has created good information to you, and we will see you soon. Thank you all, and bye.